Okay, so we people are live right now, and we have logged in here for this pharmacology PYQ discussion. Yeah, so I don't know, guys, you are on which group, guys? Can you please guide me? Like, if I want to interact with you, on which group you people are there and you people are listening to me? So, in which group you people are there? Like, okay, anyways, guys, I'm not able to locate you people, so where we can interact with each other. So no problem. So here we have come for the PYQ discussion, the previous year questions. So the team has allotted me 50 questions to discuss with you in this 1 hour of time. So 50 questions we have to discuss. So question number one, which of these drugs is used often to manage the bradycardia? So guys, the drug of choice for bradycardia is atropine. So atropine is a drug of choice for bradycardia. The answer is A, atropine. Epinephrine is a drug of choice for cardiac arrest. So this is the drug of choice for cardiac arrest, and this is also the drug of choice for anaphylactic shock. So this is drug of choice for anaphylactic shock. This is drug of choice for cardiac arrest. Now, fentanyl is an opioid which is used as a painkiller, and aspirin is used as an antiplatelet medicine. So here the best answer is atropine. Question number two. Okay, so they have given the explanation also. Atropine is the answer. Question number two. A 45-year-old alcoholic male patient presented in OPD with drowsiness, meiosis, breathlessness after the morphine overdose. So patient is alcoholic plus he takes morphine. Now he has got a breathlessness and drowsiness, meiosis. So it's a opioid toxicity. So they ask you ki which medicine is used as an antidote. So here the answer is naloxone. Naloxone is an antidote of opioid toxicity. So phenobarbital is a barbiturate, and the treatment of choice for phenobarbital toxicity is forced alkaline diuresis. So forced alkaline diuresis is treatment of choice for phenobarbital toxicity. And acetylcysteine is the drug of choice for paracetamol or the acetaminophen. It is the best medicine for acetaminophen or the paracetamol toxicity. And physostigmine is an antidote of choice. It is an antidote of choice. Physostigmine is an antidote of choice for atropine toxicity or the datura poisoning. So datura poisoning, atropine toxicity, we use physostigmine. Now we have a medicine. Question number three. Diazepam is a drug that is given for the treatment of epilepsy. So please remember, guys, benzodiazepines are the drug of choice. They are drug of choice for any type of acute attack of seizure. So acute attack of seizures, the best medicines are benzodiazepines to be given. So benzodiazepines are the medicines that are given for the treatment of uh, acute attack of seizures. Now for angina, the drug of choice for acute angina, the drug of choice is nitrates, that's nitroglycerin. So that's a drug of choice for this condition. For myocardial infarction, the first drug to be given is aspirin. So aspirin is a first drug to be given for myocardial infarction. And for anaphylaxis, we people have covered in the previous question. Adrenaline is a drug of choice for this condition. So question number three, answer is D really. Question number four, the diagram shows you the pathogen with a special enzyme. Which of these drug would be used? So we have a reverse transcriptase enzyme given to you. So reverse transcriptase inhibitor in this topic is tenofovir. So tenofovir is an HIV drug. It's a reverse transcriptase enzyme inhibitor. Acyclovir is an antiviral. This is a drug of choice for herpes virus. This is drug of choice for herpes virus. Reltegravir is given for HIV. It's an integrase enzyme inhibitor. This is an integrase enzyme inhibitor. And the medicine that ends with the word navir. All these medicines are protease inhibitor. So these medicines are also given for HIV treatment. So medicines are given for the treatment of HIV, and all these medicines are protease inhibitor, which end with the word navir. So nelfinavir is a protease inhibitor, reltegravir integrase inhibitor, tenofovir is an NRTI. It's a nucleoside reverse transcriptase enzyme inhibitor. Question number five. A patient underwent a tooth extraction and she has a history of peptic ulcer disease. So which painkiller we can prescribe after the tooth extraction? So the patients who have peptic ulcer disease, we mostly give them the COX-2 inhibitors. So medicines which are selective COX-2 inhibitors, all these medicines end with the word COXIBs. So here the drug of choice is etoricoxib. So best medicine to be given is etoricoxib. Now paracetamol is a drug which has analgesic property, which also has antipyretic property, but the patient who has to undergo tooth extraction, we assume this is a quite inflammatory procedure and the patient may have the infection at the site of tooth where we are removing it. So paracetamol is a medicine which has no anti-inflammatory property. So because of the inflammation, the patient may have the pain, patient may have the fever. So that pain and fever due to inflammation cannot be controlled by paracetamol. And hence the patients of peptic ulcer disease, in this MCQ, two medicines are safe. We will choose etoricoxib as the best medicine because that will not cause GAT side effect at all. And the medicine has a good anti-inflammatory property. Question number 6. White scrapable curd-like patches observed on the buccal mucosa of a diabetic patient. So patient has got the oral candidiasis, oral thrush, and they are asking which medicine we can use for this condition. So here the clotrimazole. So clotrimazole is an antifungal drug. This can be given, but overall drug of choice for this condition is a fluconazole. Now cotrimoxazole is an antibiotic. So all these other medicines are antibiotics which are given for bacteria, not given for fungus, given for bacteria. So in this MCQ, only one drug is given as antifungal, that is a clotrimazole, but overall best medicine is fluconazole. Now, question number 7, which is a dihydrofolate reductase inhibitor used in the treatment of cancer? So, answer is methotrexate. So, methotrexate is dihydrofolate reductase enzyme inhibitor. Now, actinomycin and 5-fluorouracil are those two medicines which are DNA polymerase enzyme inhibitor. So, these medicines are DNA polymerase enzyme inhibitor. And to prevent the methotrexate toxicity, we have to give a medicine along with it. The medicine name is leucovorin, which is also known as folinic acid. So folinic acid, leucovorin can be given with methotrexate. So question number 7, answer is A. Question number 8, a 28-year-old female admitted in ICU for the altered sensorium. Now she has fever, deranged vitals, and nuchal rigidity. So she is a typical case of meningitis. So she is admitted in ICU with meningitis. Now what is a drug of choice? So whenever a patient has come to us with meningitis, we cover gram-negative bacteria, we cover some gram-positive bacteria. So there is a gram-positive bacteria, Streptococci pneumoniae, that will cause this pneumonia very commonly. There is a gram-negative bacteria like the H. influenza that will cause pneumonia, that will cause meningitis, not the pneumonia. So Streptococci pneumoniae can cause meningitis. H. influenza can cause meningitis. Gonococcal bacteria, meningococcal bacteria. So we have a meningococcal bacteria. It's a gram-negative bacteria. This will also cause meningitis. And we have some presence of MRSA also. So MRSA can also cause meningitis. So to cover gram-negative bacteria, we mostly give generation 3 cephalosporin. So cefotaxime is generation 3 cephalosporin. This is given to cover the gram-negative bacteria. And vancomycin is the one which is mainly given to cover gram-positive bacteria, and this can also cover MRSA. So here the best answer is A. We will mark the best answer as A. Now we will not give cefazolin. Cefazolin is a generation 1 cephalosporin which is useful only against gram-positive bacteria. So vancomycin against gram-positives, generation 1 against gram-positive. So no rationale of giving in meningitis. Right, guys? Rifampicin is a TB drug. We mostly do not give for the treatment as a first drug because we don't want that the patient will develop the uh, resistance. So rifampicin is used judiciously in day-to-day practice. Ciprofloxacin, clindamycin is a one more combination that we can try here, but the best combination to be chosen here is cefotaxime plus vancomycin. That will cover most of the bacteria causing the infection. Now, clindamycin is mainly against anaerobes, like whenever we have to cover the anaerobes plus the gram-positive bacteria. So, guys, let me tell you, meningitis के case में until unless the abscess word is not given, you will not think about anaerobes. That's why clindamycin is not a good option to be chosen. Plus, if you give clindamycin, the risk of pseudomembranous colitis is very high. That's why the best answer to be chosen here is A. Now, the next question, penicillamine is an antidote we use in Wilson's disease. This is given for the elimination of the copper. So this is Wilson's disease due to the accumulation of copper in the liver that will cause liver damage. Later on can result in CNS toxicity. So penicillamine is an drug. It's a chelating agent that will bind to a copper and help in elimination of the copper from the body. So penicillamine, answer is C. Question number 10. Which of these drugs is used as a intraoperative muscle relaxant in a maxillofacial surgery. So maxillofacial surgery, we assume these are the daycare surgery where the patients are usually not admitted and we discharge the patient on the same day. So we required a short-acting muscle relaxant. So we have a mevacurium. Basically, in this question, only mevacurium is a muscle relaxant, and that is also a short-acting muscle relaxant that we prefer to use in daycare surgery. Now, propofol is a GA drug that we prefer to use in daycare surgery. Lignocaine is a local anesthetic. So, propofol is GA, lignocaine is LA, and pantoprazole is a proton pump inhibitor. So, in this MCQ, only one answer is possible, that is mevacurium. Question number 11. What is the drug of choice for absence seizure? So the best medicine for absence seizure, that is ethosuximide. So ethosuximide is the best medicine for the treatment of typical absence seizure. So for typical cases of absence seizure, ethosuximide is the drug of choice, which is a T-type calcium channel blocker. So this is the calcium channel blocker ethosuximide that is useful for absence seizure. But in this MCQ, it is not given. So after ethosuximide, we mark sodium valproate and lamotrigine. So sodium valproate, lamotrigine will be the second and third drug of choice. So you will mark the valproate as the best medicine to be here. Question 11, answer is A. Now carbamazepine is a drug of choice for trigeminal neuralgia. Diazepam is given for acute seizure. And phenytoin is the drug that we can use for maintenance therapy for the treatment of generalized seizure as well. Now, question number 12, what is the drug of choice for PSVT? So, PSVT is a condition where the adenosine is the drug of choice. So, adenosine is the best medicine which is given by IV bolus dose. So, the first dose of the medicine is 6 milligram. The second dose of the medicine is 12 milligram. This is given for the treatment of PSVT. Now, verapamil is a second drug of choice. It's a second drug of choice for PSVT. And we can also use beta blockers like esmolol, propranolol for the treatment of PSVT. So the medicines which are given for PSVT, we can remember like this way. ABCD, A stands for adenosine, B stands for beta blocker, C stands for calcium channel blocker like verapamil, and the D stands for digoxin can also be given for PSVT. So question 12, answer is A. Question number 13, allopurinol is a xanthine Allopurinol is a xanthine oxidase inhibitor. Is a which type of inhibition? So answer it's a competitive type of inhibition. So allopurinol is a competitive inhibitor of xanthine oxidase enzyme. And there is a one metabolite of allopurinol. The name is oxypurinol. Now this is a pseudo irreversible. This is a pseudo irreversible blocker of xanthine oxidase enzyme. So oxypurinol is a metabolite of allopurinol, which is a pseudo irreversible blocker of xanthine oxidase enzyme. So pseudo irreversible means the medicine is a competitive blocker. Actually, this is a competitive blocker, but this competitive blocker is difficult to overcome. Basically, competitive block is easy to overcome, but in this case of oxypurinol produced competitive block is difficult to overcome. So we call it pseudo irreversible blocker. But actually, in actual, both allopurinol and metabolite are competitive blocker. The only difference is the competitive block produced by the oxypurinol is difficult to overcome, and hence we call it pseudo irreversible. So overall block is competitive only. Question 13, answer is B. Question 14, again the same question has been asked. Penicillamine is an antidote of copper. Answer is A, copper. Question number 15, the only diuretic which exhibit ototoxicity. So only diuretic which exhibit toxicity is furosemide. So furosemide is a loop diuretic which can cause ototoxicity. Even the thiazides can cause ototoxicity, but the risk is low. So here the answer is furosemide. Furosemide is a loop diuretic. So this is the one that will cause ototoxicity as a side effect. Even thiazides can also cause, but furosemide you will mark as a better answer. Now, question number 16, least anti-inflammatory drug among the following that we discussed in one of the previous question, paracetamol. So paracetamol has no anti-inflammatory property, so it's not a good medicine to treat the pain and fever due to inflammation. Now, naproxen is a non-selective and non-steroidal anti-inflammatory drug that is given for migraine. So naproxen is a painkiller for migraine. Aspirin is an anti-platelet medicine. This is an anti-platelet medicine, and celecoxib, like the medicine ends with the word coxib, it's a COX-2 inhibitor. So question 16, answer is B, Bombay. Question number 17, which of the following antihistaminic drug have more antihistaminic and least anticholinergic property? So guys, we have a generation 2 antihistaminic medicines. Generation 2 antihistaminic medicines which have very less anticholinergic property. So these medicines are like cetirizine. So C stands for cetirizine. A stands for Allegra. So I'm just writing the name of a brand, Allegra. Allegra is actually a fexofenadine. So Allegra is a fexofenadine. Then we have a levocetirizine. Cetirizine, levocetirizine, Allegra. We have a medicine like loratadine. We have a medicine like loratadine, and similarly, we have a drug like desloratadine. And here we have a drug Ebastin. So all these medicines are generation 2 medicines: cetirizine, Allegra, levocetirizine, loratadine, desloratadine, and Ebastin. These medicines are generation 2. These medicines also have very less CNS side effects. These medicines also have very less CNS side effects. So question 17, answer is A. Question number 18. Which of the following drug are used to dilate the cerebral vessels? So answer here is nimodipine. So nimodipine is the medicine which is having a word MO. So this medicine can cause meningeal vasodilation. This will result in meningeal vasodilation. So cerebral vasodilation, meningeal vasodilation is done by nimodipine. It's a drug of choice for vasospasm. Drug of choice for vasospasm that is seen after subarachnoid hemorrhage. So vasospasm seen after subarachnoid hemorrhage, we can use nimodipine. Now, these two medicines has anti-arrhythmic property. Like in one of the previous MCQ, we have covered that these medicines are given for the treatment of PSVT. Medicines are verapamil, diltiazem, and nifedipine is a drug. It's a drug of choice for preterm labor. So in pregnant females, we can use this medicine. It's a drug of choice for preterm labor. And you can remember like this way, nifedipine is having a word FE. So this is given for the female problem. So this is given for the female problem. The drug is nifedipine, and the important side effect of nifedipine is a gum hypertrophy. So one of the important side effect of nifedipine is gum hypertrophy side effect of this medicine. Question number 19. Which opioid has no additional anticholinergic action? So here the multiple answers can be possible, but the best possible answer is methadone. So methadone is a drug which has no additional anticholinergic property. So methadone is a drug which has no additional anticholinergic property. Even tramadol also does not have anticholinergic property. So like both answers can be possible. Maybe there is some problem in the feedback of this question, but the overall best answer is methadone here. Now pethidine and pentazocine, they have the anticholinergic property, and therefore the important side effect of the medicine is tachycardia. So pethidine, pentazocine can cause tachycardia due to their anticholinergic property, but tramadol, methadone will not have this property. So overall answer is A. Question number 21, 20. Monoclonal antibody used in the treatment of rheumatoid arthritis. So answer is infliximab. So this infliximab is a medicine which is a TNF alpha blocker. So we have the other medicines like etanercept. We have the medicines like etanercept, adalimumab. So these medicines are also TNF alpha blocker given for rheumatoid arthritis. Omalizumab is IgE inhibitor. This is given for the treatment of bronchial asthma. Trastuzumab is a drug which is HER2 new inhibitor, and this is given for the treatment of breast cancer. And we have a drug basilizumab. So basilizumab is a medicine which is CD25 inhibitor. Now CD25 is a marker of T4 cell. So this is inhibitor of T4 cell activation by inhibiting the CD25. So by inhibiting the T4 cells, this is used as an immunosuppressant. So after kidney transplant, I can use this medicine as an immunosuppressant. The drug name is basilizumab. Basically, this could be basiliximab. It's not basilizumab. Then, or maybe they have given some other name. The spelling mistake is there. Question number 21. Which drug is given for H1N1 infection? So H1N1 is a swine flu, and the drug of choice for swine flu is oseltamivir, and the mechanism of action of this medicine is neuraminidase enzyme inhibitor. So this is neuraminidase enzyme inhibitor. It's the best medicine for the treatment of swine flu. Right now, ribavirin is a drug that we can try for the treatment of human metapneumovirus. So this medicine we can try for the treatment of human metapneumovirus. This medicine name starts with R. This is a RNA inhibitor. So question 21, answer is A. Question number 22, what is the drug of choice for the treatment of PSVT? So again, the same question is asked. Adenosine is the answer. Now, lignocaine is a second drug of choice for ventricular arrhythmia. Lignocaine is a second drug of choice for ventricular arrhythmia. The drug of choice for ventricular arrhythmia is amiodarone. So amiodarone is a drug of choice, but lignocaine is a second drug of choice for ventricular arrhythmia. Now, quinidine and digitalis are other antiarrhythmic medicines belong to this class. Question number 23. A patient gets community-acquired pneumonia after staying in the air-conditioned environment. Which organism is responsible? So guys, Legionella is a typically seen in those cases causing the pneumonia where the patient is living in a closed space, AC environment, the space is closed, so the bacteria can spread from one room to other room through the AC vents. So Legionella is a atypical bacteria. This is a type of atypical bacteria. And against Legionella, we cannot use cell wall inhibitor. We cannot use cell membrane inhibitor. So against this bacteria, we cannot use cell wall and the cell membrane inhibitor. So the drug of choice for Legionella infection is azithromycin. That's a protein synthesis inhibitor. So azithromycin is a protein synthesis inhibitor. By acting on 50S ribosome, it's a protein synthesis inhibitor. So this is the drug of choice for Legionella infection. Now for chlamydia infection, doxycycline is the drug of choice. And for Pseudomonas infection, we give ceftazidime. So ceftazidime is an generation 3 cephalosporin. It's a drug of choice. For Staphylococcus, we have the multiple drugs that we can use. According to the resistance present in the Staph aureus, we can choose the best medicine. So question 23, answer is A. Question 24, a non-diabetic patient reports of UTI. So we have a drug known as dapagliflozin. So these medicines belong to a class SGLT2 inhibitors. So these antidiabetics are SGLT2 inhibitors. They will act on PCT of kidney. So medicines will act on PCT of kidney, and by acting on PCT of kidney, these medicines can result in loss of glucose in the urine. Medicines will act in PCT of kidney, inhibit the pump, loss of glucose in the urine, and this glucose in the urine can result in increased risk of UTI because glucose will act as a culture media for the bacteria. Now, metformin is the best medicine for diabetes mellitus 2, and the important side effect of metformin is nausea, diarrhea. So this medicine can cause nausea, diarrhea as a side effect, can result in lactic acidosis. So can result in lactic acidosis, can result in vitamin B12 deficiency, right? So vitamin B12 deficiency, lactic acidosis, diarrhea, and nausea can be seen as a side effect. Now, gliclazide is a sulfonylurea, and vildagliptin is a medicine which is a DPP4 enzyme inhibitor. So, question 24, answer is A. Question number 25, a young female reported with fever, cough, blood stained sputum for the 3 months. Now, she was started on anti-tubercular therapy. To prevent pregnancy, she was on OCP, but after a few months, she got pregnant. What is the reason? So, answer is rifampicin is a liver enzyme inducer. Rifampicin is a liver enzyme inducer, can induce the metabolism of OCPs. So this can induce the metabolism of OCP. That's the main reason for the failure. And whenever rifampicin will have drug interaction with any other drug, always we have to change the other drug. We never change the rifampicin. So here also we change the OCP. We don't change the rifampicin. We continue with rifampicin. We change the OCP and we tell the patient to use the barrier methods for the contraception instead of taking the oral contraceptive pills. Question 25, answer is A. Question 26. A young adult male complains of urethral discharge and pain on the micturition. Diagnosed with gonorrhea, what is the drug of choice? So, gonorrhea is a gram negative bacteria. And for gram negative bacteria, we always give generation 3 cephalosporin. So, ceftriaxone is the drug of choice. So, ceftriaxone, single dose, is the best medicine for the treatment of gonorrhea. Now, vancomycin is a medicine for gram positive bacteria. It's a drug of choice for MRSA. Methicillin resistant Staph aureus, vancomycin is a drug of choice. Question number 27. A 55-year-old female wants to get rid of the facial wrinkles below the eyes. So she has used the neurotoxin, and this neurotoxin is a Botox or botulinum toxin. What is a statement that is true? So answer is neurotoxin, botulinum toxin is a temporary modality. Like this will act only for few months. This will act for 2 to 3 months for the treatment. After that, we have to take the next sitting of the Botox. So Botox is a temporary modality for the treatment of these wrinkles. And this is the Botox which is inhibitor of the acetylcholine release. This can inhibit the acetylcholine release from the presynaptic terminals. So from the presynaptic nerve terminal, this will inhibit the release of acetylcholine. This is how the Botox can act in the body. Question number 28. A middle-aged man presented with signs of gout for which you have given allopurinol. It's an inhibitor of xanthine oxidase. Okay, this we have discussed already. It's a competitive inhibition. We have already covered. Question number 29. The patient was given vancomycin. What is given in vancomycin resistant MRSA? Okay, so basically the question should be which drug is given for VRSA, vancomycin resistant Staph aureus. There is no terminology like vancomycin resistant MRSA. So vancomycin resistant Staph aureus VRSA. So here with the drug of choice is daptomycin. Here the drug of choice is daptomycin, right? But daptomycin should not be given in patients of CKD. So this is avoided in patients of CKD or the kidney disease. So ideally we prefer to use a medicine, we call it TJ cycline. So tigecycline is a drug which is purely metabolized by the liver. So that is a second best option that we can give after daptomycin. But here in this MCQ, both medicines are not given. Both daptomycin and tigecycline is not given. So maybe this question was a old MCQ, and up till few years back, linezolid used to be the drug of choice. It used to be a drug of choice for VRSA, and linezolid is also safe to use in CKD. It is also safe to use in CKD, linezolid, and that was the best answer to be marked for VRSA. So question 29, answer is A. Question number 30, a patient with CKD requires antibiotic administration for the infective endocarditis. Now he is allergic to penicillin. Which antibiotic is given? So whenever the patient is allergic to penicillin, the best alternative is cefazolin. So we can give cefazolin, we can give vancomycin. So we can give cefazolin, we can give vancomycin, right? And we can also give azithromycin. So the alternatives are cefazolin, vancomycin, azithromycin. Now cefazolin, vancomycin are the medicines. Their dose need to be decreased in patients of CKD. So this patient is patient of CKD also. So here in this case, guys, ampicillin is also unsafe. Ceftriaxone is one of the drug that we can try here. So ceftriaxone we can give to this patient, but the best answer to be chosen here is, so I think the best answer cannot be chosen because like there was a time when, okay, this may be an old MCQ. There was a time when clindamycin used to be given. Like nowadays, clindamycin is no longer being given for this prophylaxis. So, like nowadays, if you would ask me, sir, what is the answer? Answer would be azithromycin. So, answer would be azithromycin as a alternative drug. But clindamycin could be answer when this question was asked around few years back. So at that time, clindamycin used to be given, but nowadays clindamycin is not given. Yes. So even in the answer key, they have given the clindamycin as the best answer, right? But still, I will say clindamycin no longer recommended. The best answer would be azithromycin in case the question is repeated. Question number 31. Basically, in this prophylaxis, you have to cover gram-positive bacteria as well as the anaerobic bacteria. You have to cover gram-positive, gram-negative as well as the anaerobic bacteria. So this is the medicine that will cover this spectrum. So azithromycin is the best option to be chosen to cover gram-positive, negative, anaerobic. Question number 31. What is the true about the mechanism of action of beta blockers in angina? So beta blockers are the cardiodepressive medicines. They reduce the force of contraction. And by reducing the force of contraction, they reduce the oxygen demand of the heart muscle, reduce the workload of the patient by causing the bradycardia. So they can cause bradycardia, they can decrease the oxygen demand. So answer is C. So question 31, answer is C regarding the beta blockers given for the treatment of angina. But the drug of choice for acute angina, drug of choice for acute angina, we have discussed in question number 1 also. That's a nitroglycerin that is given by sublingual route. Question number 33. So patient, 40-year-old patient on warfarin 4 gram for prophylaxis of DVT. Now patient suffer from dental infection and given ceftriaxone. Now she has got a vaginal bleed. Now guys, this was a bit controversial question which where you people are always confused. So guys, please remember warfarin is a drug. This is an anticoagulant medicine. So this medicine is an anticoagulant medicine, and anticoagulants are those medicines which are inhibitor of the clotting factor pathway. So this is the medicine which is inhibitor of clotting factor pathway. So we call it hypoprothrombogenic effect. So this medicine has hypoprothrombogenic effect in the body. So this is hypoprothrombogenic effect by inhibiting the clotting factor. You have to understand the thrombocytopenic effect is not this. Thrombocytopenic means the medicine should be inhibiting the platelets. So medicine should be decreasing the platelet count, but this medicine will not inhibit the platelet. Rather, this is inhibitor of the clotting factor. Clotting factor pathway is different, platelet pathway is different, right? And the cephalosporins are the drugs. They will also act like a warfarin. So they also have the hypoprothrombogenic properties. So they have the hypoprothrombogenic property and they promote the action of warfarin, can result in bleeding. So they inhibit vitamin K oxidoreductase enzyme, inhibit vitamin K dependent clotting factor. Now, apart from that, if we give third generation cephalosporin, they inhibit the gut flora. So by inhibiting the small intestine bacteria, they will inhibit the enterohepatic circulation of vitamin K. You have to understand vitamin K is conjugated with the protein in the liver, and now it will come to the intestine for elimination. but bacteria will deconjugate the vitamin K again, and now the vitamin K is again reabsorbed as a fresh vitamin K from the intestine, again go back to the liver. So vitamin K keep on coming to the intestine, again going back to the liver, again coming to intestine, again going back to the liver. Because of the bacteria, the vitamin K always get deconjugated and it is again available for the action. So by giving this medicine ceftriaxone, this will inhibit the gut bacteria, gut flora. Now the vitamin K reabsorption or deconjugation is not possible, and hence there is a vitamin K deficiency that will take place, and this will resemble the warfarin action. Warfarin will also inhibit the vitamin K action. So this is the reason for the bleeding caused in this female. So answer is gut flora. Gut flora is inhibited by the ceftriaxone. So best answer is A. Question number, so this answer is not given wrong in the answer key. Answer is A only. Question number 34. A middle-aged patient presented with fever and diarrhea and diagnosed with typhoid and treated with antibiotic. After 2 days, the patient reported gingival bleeding, which is the most probable medicine. So again, the same question, ceftriaxone. This medicine can inhibit vitamin K function and can result in bleeding as a side effect. So question 34, answer is D, Delhi. Okay, one more thing is ceftriaxone is one of the leading drug that we use for typhoid. It's one of the most commonly used medicine in hospital for the treatment of typhoid. So typhoid is caused by the Salmonella typhi. Salmonella typhi is a gram-negative bacteria, and for gram-negative bacteria, we prefer to use generation 3 cephalosporin. Ceftriaxone is one of the main antibiotic that we can use. Second drug which is useful here against typhoid is ofloxacin, but ofloxacin will not cause bleeding. Ceftriaxone can cause, so hence the best answer is D, Delhi. Question number 35. In which clinical testing the large population for comparing the drug efficacy is used? So maximum number of population, large sample population is used in phase 3. So in phase 3, we use the maximum number of sample size. This is the best phase to compare the drugs, best phase to see the medicine pharmacokinetic, pharmacodynamic. So all pharmacokinetic parameters are best calculated in phase 3. So question 35, answer is A. Now, question number 36. A young female in first trimester of pregnancy presented with Plasmodium falciparum malaria. So, in Plasmodium falciparum malaria, in first trimester of pregnancy. So, in first trimester, we only give quinine. We only give quinine as a best medicine. But in second and third trimester, we give the usual regimen. We call it artemisinin combination therapy. We give artemisinin combination therapy. So we can give artesunate, we can give the combination with the pyrimethamine sulfadoxine. But in first trimester, we give only quinine. In this MCQ, they're asking which other medicine can be given with quinine. So although we don't give any medicine, but still if we have to choose the best medicine, clindamycin is the best medicine to be given. You people have to understand sulfadoxine is a folic acid pathway inhibitor, and it is given in the second and third trimester as a part of ACT regimen, not given in first trimester. Doxycyclines, tetracyclines typically contraindicated in pregnancy because they interfere with the baby teeth and the bone growth. And primaquine is a medicine. This medicine this medicine has three strong contraindication. This medicine should not be given in pregnancy, should not be given in children, should not be given in G6PD deficiency. So these are three strong contraindication: pregnancy, children, and G6PD deficiency. You can see these three medicines are strictly contraindicated in pregnancy. We don't have left with any other option. So the best answer to be marked is C. Now question number 38. A young child accidentally popped up 20 tablets of iron, and which drug is given? So here we have patient will have the iron toxicity, severe iron overloading. So we have to give the medicine by the IV route. So deferoxamine is a medicine that is given by IV route. This we can try. Penicillamine is given for copper, and deferipron is again given for iron, but this is given by oral route. So deferipron and deferoxamine given for iron, and dimercaprol, you can see the name mercury. So this is given for the mercury poisoning. The medicine is dimercaprol. So dimercaprol given for mercury, and penicillamine given for copper, deferoxamine given by IV route for iron toxicity, and deferipron given by oral route. Question number 39. A carpenter accidentally cut the tip of his finger and reported to the OT for the reattachment. Now, you will not use the lignocaine with adrenaline. The reason is quite obvious, guys. Lignocaine can cause, adrenaline can cause vasoconstriction, and the fingers are something which are supplied by the end arteries. So, patient will have the ischemia or gangrene of that place, right? So, because of the ischemia and gangrene, adrenaline is not given along with lignocaine as a local anesthetic in this case because the fingers are supplied by the end arteries. right? In case this will start, in case you have accidentally given, the drug of choice for this vasoconstriction ischemia caused by adrenaline is phentolamine. So phentolamine is a drug that is given for the reversal of the effect of adrenaline on the blood vessels. Question number 40, a new anesthesia registrant mistakenly inject a parasympathomimetic drug in a male patient. Inject, okay. So what is the immediate effect? So guys, parasympathetic drugs can act on muscarinic 3 receptor, can release nitric oxide. And because of this nitric oxide, there is increase in the level of cyclic GMP in the body, and this will cause vasodilation, and hence the patient BP will fall, and patient will have the erections. So male patients can have erections. So penile erection can occur in this patient. Now, parasympathetic system will increase the urination, can cause meiosis. So, decreased urine output is not seen, meiosis will be seen, and bronchospasm is seen. And during our lecture, we people have made a mnemonic parasympathetic action. We can remember with a mnemonic, that is dumbbells. So, here we don't have the bronchodilation, rather, we have bronchospasm. Instead of mydriasis, we have meiosis, and instead of retention of urine, we have the urination. So, question 40, answer is D. Delhi. Question number 41. Best time to take proton pump inhibitors. A very easy question. Proton pump inhibitors should be taken before meal. So 30 to 40 minutes before meal, the drug should be taken. And proton pump inhibitors are the inhibitor of H plus K plus ATPase pump. So this is the name of the proton pump inhibited by the drugs. And these medicines are the irreversible inhibitor of this pump. So question 41, answer is C. Question number 42. A woman has myocardial infarction and her father also had a history of same event. So it's a family history. Doctor given her atorvastatin. So risk factors are there and she has already got an MI. So how does this atorvastatin act in the body? So it's a very obvious question. It's a competitive inhibitor of HMG CoA reductase enzyme. Therefore, reduce the level of cholesterol in the body. So this is the enzyme. It's a rate limiting enzyme in the cholesterol synthesis in the body. So to reduce the cholesterol, this is the best medicines to be given, competitive inhibitor of HMG CoA reductase. Now to reduce the level of triglyceride and the VLDL in the body, we give a medicine that is fibrates. So the best medicine is fibrate, fenofibrate. Now this medicine will act on PPAR alpha receptor. Like statins will act on HMG CoA reductase receptor. They are the best medicine for hypercholesterolemia. But along with cholesterol, sometimes triglyceride is also high. For them, for that triglyceride, we give fenofibrate. So question 42, answer is A. Question 43, what is the best method of adrenaline administration in anaphylactic shock? So we give it by intramuscular route. We prefer to give medicine in vestus lateralis muscle. We give the medicines in our thigh muscles, and the concentration that we use is 1 is to 1000. So 1 is to 1000 concentration. The dose of the medicine is 0.5 milligram. So 0.5 milligram dose concentration. This route is intramuscular. This is how we give this medicine for the anaphylactic shock, and this is given to antagonize the effect of histamine. This is given to antagonize the effect of histamine. Question 43, answer is C. Question 44. Which drug for managing the thalassemia patient can be given only parenterally? So thalassemia means the patient will undergo the repeated blood transfusion, and repeated blood transfusion will lead to iron overloading. And for this iron overloading, we have to give medicines, and we discussed in one of the previous question, deferoxamine given by IV route and deferipron given by oral route. So if in case they have asked you the oral drug, you will mark the deferipron, and in case they will ask you the parenteral drug, you will mark deferoxamine. So question 44 answer is okay. One more drug given by oral route is deferasirox. Deferasirox is one more drug that is given by oral route. Question 45, which of the following is not an adverse effect of AC inhibitor? So AC inhibitor side effects we people have discussed during our lecture, that is with the mnemonic captopils. So in this captopils, guys, we discussed that A stands for angioedema. So C is for cough, A is for angioedema. So C, cough and angioedema is due to the accumulation of bradykinin in the body. So this side effect is seen. Now the P stands for hyperkalemia. P is for potassium. So medicines will not cause hypokalemia, will cause hyperkalemia. Now, medicines can cause taste change. So, taste change is known as dysgeusia clinically, and cough we have discussed already. So, the full form you should remember from your notes. So, best answer is B, Bombay. Hypokalemia is not seen, hyperkalemia is seen. Question number 46. A patient has got prosthetic heart valve and taking warfarin. Yes. So, after the valve replacement surgery, we put patient on anticoagulant warfarin, and now the patient has got a bleeding as a overdose. So, guys, the antidote of choice for warfarin is vitamin K, but this is a slow acting medicine. And because of the slow action, if the patient is having a bleeding, if the patient is having a bleeding on urgent basis, we have to stop the medicine action. So vitamin K will take 4 to 5 days to act in the body. So the action is seen after 4 to 5 days, and till that time, patient cannot afford the bleeding. So we can stop the bleeding immediately by giving a replacement of the clotting factor, that is in the form of fresh frozen plasma. Guys, you people have to understand, if the patient will have the heparin toxicity, we have the antidote protamine sulfate. Now protamine sulfate is a fast acting medicine. So in heparin toxicity, if there is a bleeding, we need not to give fresh frozen plasma because your antidote itself is faster acting. But in case of warfarin, we have a problem that the antidote is slow acting medicine. That's why in case of bleeding, we give fresh frozen plasma to the patient. Question 46, answer is fresh frozen plasma. Now, tranexamic acid is inhibitor of tissue plasminogen activator. So we have tranexamic acid, we have epsilon amino caproic acid, YACA. This is inhibitor of tissue plasminogen activator, and this will inhibit the conversion of plasminogen to plasmin. Inhibit the conversion of plasminogen to plasmin, and these are used as an antidote. These are used as an antidote of thrombolytic medicines, fibrinolytic medicines. Question number 47. Like, what is the cause of diffusion hypoxia? Diffusion hypoxia by nitric oxide. So, guys, whenever we switch off the cylinder, like after doing the surgery, whenever we switch off the cylinder, nitric oxide has a property to cross the membrane at a very fast speed. So, when this we switch off the cylinder after the surgery is over, so this medicine will rapidly move from blood to the alveoli. So we have the medicine present at the time of surgery in plasma. Now the moment you stop the cylinder from outside, the medicine will start going back in the environment. This will rapidly move from blood to the alveoli, and that will decrease the concentration of oxygen. Right. So immediately this medicine which is there in the blood, so this medicine will start going to the alveoli. Now when this medicine will take the place of this alveoli, all the volume is occupied by the nitrous oxide. Now oxygen cannot take entry and patient will have the hypoxia. The same reason when we start the cylinder, when we start the surgery, we start giving N2O. This will also rapidly take entry in the blood. This will take entry in the blood at a very fast speed. That is responsible for second gas effect. So that is responsible for second gas effect. So entry will lead to second gas effect, and the exit from this blood that will lead to diffusion hypoxia. So question number 47, answer is B. Question number 48. A pregnant lady consumes high amount of alcohol during first trimester. What is a possible effect that can be seen in the baby? So baby can have the small palpebral fissure. The baby will have the long flat philtrum, not the enhanced philtrum column. There's a long flat philtrum. And because the philtrum is long and flat, the baby will have the thin upper lip. So baby will have the thin upper lip because the philtrum is long as well as flat. So we call it thin upper lip, long flat philtrum, small palpebral fissure, a small palpebral fissure. And the baby will also have the low IQ. Baby will have the low mental status, low IQ. So baby can have the mental retardation. Baby can have also have the mental retardation, and this baby will be hyperactive. And this syndrome is known as fetal alcohol syndrome. Question 48, answer is C. Question number 49. Sodium potassium ATPase pump inhibited by a drug digoxin. So digoxin is a drug that we use for congestive heart failure. We use this medicine for congestive heart failure as an inotropic drug. This is a sodium potassium ATPase inhibitor. Fluconazole is an antifungal. This is a drug of choice for oral thrush. So that part we people have already covered. Now omeprazole is a proton pump inhibitor. It's a inhibitor of a H plus K plus ATPase pump. Ranitidine is a H2 receptor antagonist, histamine 2 receptor antagonist given for acidity. So question 49, answer is B, Bombay. Question number 50, the last question. Which of the following is a bactericidal drug? So here the bactericidal medicine is an aminoglycoside. So during our class, we discussed that the medicines which are cell wall inhibitor, medicines which are cell membrane inhibitor, and the medicines which will act on the nuclear pathways. So medicines that will act on nuclear pathways, these medicines are the bactericidal medicines. And the medicines which are protein synthesis inhibitor, medicines which are folic acid pathway inhibitor, these medicines are bacteriostatic drugs. So protein synthesis inhibitor, folic acid pathway inhibitors are bacteriostatic. Cell wall inhibitor, cell membrane inhibitor, and the nuclear pathway inhibitors are bactericidal. But there are some exception, like one of the exception is aminoglycoside. Aminoglycoside is a protein synthesis inhibitor. This is a bactericidal medicine, not the bacteriostatic medicine. This will act on 30S ribosome, and by acting on 30S ribosome, this is inhibitor of the protein synthesis. So question 50, answer is A. So we have discussed the 50 questions which are asked recently in your exam. And after that, in case you people have still have some doubt, you can WhatsApp me on this number. I'm always happy to answer your queries on this number. And also we can connect with each other on this Instagram. And also, if you want to enjoy these daily questions of pharmacology, you can also join this group of my personal group. You can join as on Telegram. So these are the two ways by which we can connect. And also for queries, you can directly message me on the WhatsApp. Take care, guys. Take care of yourself. If still you have any doubt, please don't forget to tag me in the group also. Take care of yourself. Good night.